This is a 67-year-old patient with a cervical myelopathy, big disc herniation, compression anterior and posterior, C3, 4, 5, 6, and 6, 7. Here we are right behind C3, and you can see there's some room. You come right in here through C3, 4, and the cord is just compressed significantly, severely. Opens up a little bit, and then at 4, 5, not so bad, it is stenotic. 5, 6, a little worse on the right. And then 6, 7, we got a lot of compression. So we're going to do an anterior cervical discectomy and fusion, C3, 4, C4, 5, C5, 6, and C6, 7. We're going to remove all the anterior compression and place implants in here that are going to distract a bit, and hopefully will indirectly take some of this as it stretches out, some of this compression off, and we'll go from there. Now, the patient may need a second procedure depending on their neurologic status. I don't always do them. It depends on the patient's clinical picture. Okay, we're all done. Here's our plate and our implants. Everything looks really good. Here's where we started, and you can see his discs are collapsed 3, 4. He had the largest herniation here, 4, 5, 5, 6, and 6, 7. So very difficult getting the pictures. We're trying to localize here and here where our incision is going to be. It's a fairly large incision. And then as we're working through, we'll take another x-ray to know that we're midline at 3, 4. We'll just work through a progression here. Here I am with an instrument coming back into 3, 4. We ended up putting a distractor in, actually opening it up, and then progressing through this towards the end of our operation here. So we're back in lordosis. Here's our final lateral. And so you can see that we've opened up each one of these levels that were closed. We were able to get back into the spinal canal in each one of these levels and take all the disc, pinch in the cord and the nerve root. So this should help this patient immensely.